I want to move us along to more discussion on these really important themes of the day. And I'm going to ask Desiree LaBeaud to come up and talk a little bit about some of her research.
Good morning, everyone. So I feel a little silly coming up here now after that plenary and talking about my little aspect of the world here. There is a recent Kamala Harris quote, do not despair, do not be overwhelmed. Now's the time to sort of roll up our sleeves and fight for who we are, really work hard. And so I think me and my lab, who I'm here really the face of a lot of people here, work really hard at what we do in our little part of the world, and so I'm going to share some of that with you today. Now, the theme for today's meeting, this research convening, is the pathway from research to impact. And so what I'm going to share with you is a little bit of where I've come from, my prior research, and then now the work that we're trying to do in a new project where we're really trying to make an impact and take you along on this little journey with me and tell you a story about what we do. So the title of my talk is Mosquito-Borne Disease, Risk and Prevention in Kenya, Making the Invisible Visible. As you all know, mosquitoes are the most deadly animals in the world. They kill nearly a million people every year, and many of these deaths are attributed to malaria. But mosquitoes carry other pathogens that kill and maim people, and many of those are arboviral pathogens, or arboviral stands for arthropod-borne viruses. And I've spent at least 12, 13 years now studying arboviral diseases in Kenya and really trying to uncover the burden of these diseases and exposure in all different types of populations. And pretty much everywhere I've looked in Kenya for these infections, I've found them. They're often overlooked as sources of fever and disability and disease because, as is the case now, malaria is often overdiagnosed and most fevers are thought to be malaria. But really significant proportions of the population are being exposed, and these infections really do have long-term health consequences, though the extent of exposure really does vary by region and by virus. And so I just want to show you a little bit of preliminary data on some of the work we've been doing for years and years. So if we just take one group of viruses, the flaviviruses, many of you know these, dengue, West Nile, yellow fever, Zika is the new kid on the block, and we look at just burden across Kenya, you can see here that significant prevalence is really happening. There's a lot of exposure. On the coast of Kenya, 40% of people are exposed. In the northeast, where it's very dry, still about 10% of people are exposed, so there's a lot of exposure. And a lot of the work I'm going to show you today happens on the coast of Kenya, so I just want to show you some detailed information about the exposure there. You can see on the left-hand side, dengue exposure, and on the right-hand side, chikungunya exposure, and you can see overall about 35% of the population or so is exposed, a significant portion. And as you'd expect, because these are mosquito-borne viruses, the older you get, the more likely you are to be exposed. So adults are more likely to be exposed than kids. But I'm a pediatrician, and still, when I look at these numbers, they're quite alarming. 10 to 20% of children are exposed, often very young in life. And what is this doing to these kids? Well, we're not really sure, right? Exposure does not necessarily equal disease. Many of these infections can be asymptomatic, but a lot of times they are symptomatic and they can have really severe health consequences. So what's really going on? How much disease is happening? Without really knowing the entire pyramid, we don't really know the true economic and public health impact of these infections. And so we really need studies to investigate this. And so that's what we're doing right now. We have a large study that's funded by NIH where we work in 4 areas in Kenya, 2 on the coast, 2 in the west. Let's see. I don't know. Oops. I don't know if I have oh, no, okay, I'm going to give up. Anyway, so on the left-hand side there, left upper, we have our our rural western site, which is called Chilaimbo, and then we have Kisumu, which is the 3rd largest town in Kenya on the lower left, which is our urban west side site, and then we have our urban coastal site, Ukunda, which is on the the upper right there, and then Msambweni, which is our rural coastal site. And what we're doing at these locations is we're trying to really understand the full pyramid, the burden of disease, asymptomatic disease, symptomatic disease, and so we're actually also getting information from vectors and environmental information to understand the dynamics of transmission. For these locations, we are collecting information on children. We have healthy children in the community who are trying to find out if they're getting asymptomatically exposed, and then we're also doing febrile surveillance in hospital sites in each of these locations. And so what have we found? Well, it turns out that dengue and chikungunya are causing disease, as we expected. And so with the acutely ill kids, as you can see on the panel on the left there, we do have seroconversions for both dengue and chick, so they're definitely causing disease in children. And then even in the healthy community, where kids are running around very healthy, many of them are exposed up to 10%, again, still have exposure. So it looks like these infections are, in fact, causing disease in these kids. So when you look, you find it. We've also documented undocumented dengue outbreaks, and we have a poster, I think it's poster number 5 here today, discussing that. And it seems that maybe dengue is even making malaria worse. It seems that those kids who have both P. falciparum malaria infections and dengue virus co-infections don't recover as quickly as kids with mono-infections. And we have a poster on that. I think it's poster number 4 today. So why is this happening? Well, it all comes down to this bad girl. Right, so this is an Aedes aegypti mosquito, and there are certain attributes about this mosquito, the behavior of the mosquito, the ecology of the mosquito, that make it a very efficient transmitter of human disease. First of all, the mosquito grows quite rapidly, so the life cycles can be quite rapid, down to 7 days from egg to adult when it's warm outside. So again, impacts of climate changing can have an impact, of course, on vector-borne diseases in many ways. The eggs are really, really hardy. They're desiccation resistant, so they can lay dormant for a year or more when it's dry outside and hot. That's important for transmission. This mosquito is a homebody. She likes to live right where she's born. And so if she's born in your backyard in a man-made container and you're there to feed on, she'll never leave you. They're very loyal. So she'll stay, and the only time they really fly more than 100 meters is if they're looking for a blood meal. They prefer to feed on people. They're anthropophilic, so if there's an animal to feed on or you, she'd much rather feed on you. They prefer to breed in man-made containers, and so if you have them in your backyard, they'll be there for you. And she's a nervous feeder, so if she bites you and you move a little bit, she'll fly off and go bite another person, and it takes about 4 to 5 people for her to get a successful blood meal, which means that she could have transmitted dengue or chick or Zika to all of those people, again, making her a very efficient transmitter of disease. And finally, she bites during the day, which is important for prevention. So how can we prevent? Well, you all know all we really have for these infections is really vector control, right? And that can happen at the household level and it can happen at the community level. At the household level, it's really source reduction. It's removing those habitats where she can live and breed. At the community level, you can do habitat removal and also larviciding, but larviciding is difficult when you have a mosquito that can breed in a tablespoon of water. And you can spray, but they're really good at hiding also, and I don't think the spraying actually is very effective at killing these types of mosquitoes. And then you can try to avoid mosquitoes, right? This is what I do when I travel. I wear repellents, I put barriers all over myself, and there's household design, right? There's actually really important architectural insights that can be done to actually improve ventilation in homes so that people don't have the doors and the windows open so the mosquitoes can't come in, and things like that. And then, of course, if you're lucky enough to be rich enough to be able to afford screens or an air conditioner, you can do that, and that's actually very helpful at preventing mosquito bites. But many of these things actually involve behavior change, right? And we all know it's very difficult to get humans to change their behavior unless they really perceive imminent, immense threat. Right? And so this is hard. It's very difficult. There are people who are experts in this, trying to get humans to change their behavior. And so I'm going to talk a little bit about this today. But this isn't going to work, right? These are my 3 beautiful boys, happily safe under their bed net in Kenya. But this is not going to work for these infections, of course, because, again, they bite during the day. This works for Anopheles gambiae that bites at night, but not for Aedes aegypti. And I'm showing you here some of our human landing catch data just to prove to you that they really are day biters. These mosquitoes in Kenya at our field sites like to bite early in the morning, and they like to bite in the early evening hours. And they're not biting at night. I don't have all the 24 hours there, but they are not biting at night. But they're breeding. They're breeding everywhere. We find habitats all over the places that we're working in, all types of man-made containers where these mosquitoes are able to come in and create large numbers in a very small amount of time. So what can we do? I mean, look at all these different containers. It looks pretty dire, right? How are we going to do local mosquito source control when there's these containers all over all of our communities? Well, the good news is that we've looked at specifically the numbers of containers and different containers that are out there, but we actually look at how many of those containers are productive for this species of mosquito, Aedes aegypti, the containers that are more likely to produce these sorts of vectors. And it turns out that the story's a little, less terrible. About 60% of pupa, which are the life forms that come right before the adult mosquito, are found in only 4 types of containers. So maybe there's a hope there that we might be able to target some of these specific containers and actually make an impact in our communities when it comes to vector-borne disease risk. So what I've shown you so far is that arboviral exposure is really common where I'm working in Kenya, and it seems to cause disease, but that's going unnoticed. That these Aedes species mosquitoes are alive and well and breeding all over the place in our communities, but that certain containers appear more conducive to breeding than others, and that we might be able to target specific containers to actually make an impact when it comes to vector-borne or mosquito-borne disease risk. And so that's exactly what we're trying to do right now with this new project. We're trying to engage schools and communities to reduce mosquito-borne disease risk in rural Kenya. And this project is pretty much led by my outstanding, fabulous PhD student from the Emmett Interdisciplinary Program on Environmental Research. I think I got that right, Jenna. Jenna Forsyth, who's over there, who should actually be giving this part of the talk, but I'm gonna try. I'm gonna try my best to make her proud, truly. So Jenna and I and Francis and Lydia, Kimoni, Moshe, and Joyce are really doing this project, and I'm excited to tell you about it today. It's funded through the Bechtel Bass Society here at Stanford. It's an internally funded proposal. So I've told you we don't have any drugs, we have no antivirals, we have no vaccines, so we're stuck with vector control. Different strategies need to be done for different types of mosquitoes. Bed nets aren't going to work here. Insecticide, larvicide's not going to work here. We really have to do larval source control. And it turns out that there was a study in coastal Kenya done not so long ago that showed that about 50% of the community uses bed nets, but only 15% practice larval source control. So there's a good chunk of the community that might be interested in decreasing their mosquito-borne disease risk, but maybe don't have the tools or the knowledge or haven't been engaged yet to do so. And so those are the people we're really trying to target. And this has been shown to be effective in other places. In India, they targeted women's groups to get community engagement, and they led to a 95% source reduction. So that's impressive. I don't know if we'll get that far, but we're gonna try really, really hard. So we want to take these invisible risks and make them visible. And this is my middle son, Everest, who is looking through a magnifying glass and checking out the larval forms of mosquitoes. So again, taking invisible risks, really exposing the risk to these communities and trying to empower them to really make the changes that are going to protect them and their families from these diseases. So we're hoping to understand existing barriers and facilitators for household source reduction, and then we're developing and testing school and community-based strategies to encourage source reduction in our communities in coastal Kenya. And we're working in 2 places, the same 2 places that the larger project is going on. And so that larger project is giving us information on hotspots and prevalence in our areas, and then we're taking this to really do the impactful work. So this intervention study is happening in Ukunda, which is our urban site, and then Msambweni, and other villages all around this area in Kenya, and I'll explain the study design in the next slide. So the first phase of this was our formative research, some of which I'll share with you today, about just understanding the perceptions of mosquito and mosquito-borne disease risk in this area. We've led a lot of workshops, and we're planning on piloting our interventions and iteratively redesigning them until we get them perfect. And then we're planning to go ahead and do this study, and that's gonna actually be happening this summer in Kenya. So we've identified 10 schools at the school level, and so we've randomized them to 5 getting the intervention, 5 aren't. And we've done all of the mosquito work, so all of the vector work. We've gone out to all of the households in the communities and censused the backyards and done mosquito breeding surveys to find out, who has a lot of mosquitoes, who doesn't, and we're using those mosquito indices as our outcomes. So we're doing baseline vector surveys, we're gonna go out and do our intervention, and then we're gonna do a short-term follow-up about 3 months after the intervention to see if we've made an impact on those mosquito indices in those backyards. And then we're gonna come back a year later to see if it was sustainable and to see if any changes we might have seen in the short term are actually still happening in the long term. So what are we hoping to do? We're hoping that we can get the community to perceive effects of individual actions, right? Intentional and unintentional water storage on mosquito breeding and subsequent disease. We're hoping to empower them to personally control mosquito breeding in homesteads to lessen disease risk, and we're hoping to improve knowledge, attitudes, and behaviors of both the kids and the parents related to mosquito-borne disease risk. And then our high impactful hopings are that we're going to ignite behavior change within communities so safe water practice actually becomes the community norm. I mean, this is all we can do until these families can actually get safe, reliable water sources, and that's going to be a long time to come, unfortunately. And then finally, we're working very closely with our government officials in Kenya to actually hopefully change some policies around adopting control efforts for non-malarial mosquito-borne disease. So preliminary findings to date, so from our formative research, we've conducted 40 in-depth head of household interviews, and these are mainly the female heads of households in our area, and we have stratified them by high-risk households and low-risk households by the mosquito breeding surveys done in their backyards. We found that many of these women became knowledgeable about vector-borne diseases after having kids, and that most only know of bed nets, and that there's a lot of confusion around proper mosquito control, but that they trust the schools for information and also the hospitals. We've also conducted 40 interviews with 6 and 7 class students from 2 different schools, and pretty much the kids know nothing about mosquitoes or their life cycle, so we have a lot of work to do there. And we're currently analyzing these themes. What we found about knowledge and attitudes is that there's definitely knowledge gaps about mosquito species, ecology, and diseases. There's, of course, a much greater concern about malaria compared to other mosquito-borne diseases. And there's this perceived importance of sort of covering the water for sanitary use because they're afraid that, we want to keep it free from insects because we're drinking it and we want to cook with it, but nothing really to do with, mosquito breeding. And that the kids know far less about mosquitoes and diseases than the mothers do. As far as behaviors, of course, the lack of water availability in this region really necessitates long-term water storage, especially during dry periods. Women and children are the ones who are fetching the water and storing it. None of the women knowingly practice mosquito source reduction, and kids really don't talk much about anything they learn at school, and the parents really don't ask the kids about anything they might be learning in school. Because during this project, we're actually hoping we could use children as the agents of change and actually have them message the parents and bring home these messages. And so we're unsure if that's going to be possible here, but I think we still might try a little bit. And what we found, too, going back out and doing mosquito surveys in all these backyards is that we started to think, we were thinking a lot before about the container type, but maybe the water purpose is actually where we should really be focusing our efforts. And if you just look here at this table, as I told you, it looks like buckets, tires, jerry cans are the ones that are really most productive of the larvae and probably of great importance. But when we look at the water purpose, if you have water that you're cooking with or you're drinking or you're using or bathing with it, it goes really quickly. It's gone in just three days or so. And so, of course, that's not long enough for mosquitoes to breed. So that water is actually really, really safe, even if it's uncovered, because it's gone. But it's that water that sits around the backyard that really doesn't have a purpose, that's just there because they don't have reliable water, that we can really target to try and cover it, to try and do something with it, to really prevent most of the mosquito breeding. The no-purpose water. So as far as our intervention goes for the curriculum, we're developing school curriculum for the lessons that are going to be taught in schools. So we have 5 lessons, one on mosquito life cycle, behavior, breeding, mosquito-borne diseases, and then prevention and control. We've come up with a lot of games. In fact, we've come up with a mosquito tag game, so if anybody's interested in playing this during the break, Jenna and I can show you how to do it. It's quite fun, but really to get the kids engaged so that they want to learn about mosquito ecology and the life cycle and breeding to try and make it fun and interesting and interactive for them. And then we're involving a lot of art in this. I don't know if Eleanor is in the audience, but we have an undergraduate student here at Stanford who is an amazing artist, and she's been drawing. I've had her art through my presentation here, but she's been making a lot of beautiful pictures for us that we can use to teach the kids because, of course, pictures are very powerful when it comes for instruction. And then as far as the community part of this goes, the intervention is going to be more of a door-to-door sort of learning and discussion with the head of household. And I think it's going to have to be very individualized. And we have 3 planned reiterative pilots that are going to be happening before we actually do our intervention this summer. So our future project goals, We are hoping to fund a mosquito scout program. Right now, that's been really effective in Malindi. What it is, it's almost like a community health worker program, but these people are trained actually to seek out mosquito habitats and destroy them. And it's been really, really helpful. So we're hoping to get that funded. If our intervention's successful, we'd love to scale it up to other schools, particularly on the west side where our other projects running would be a first step and so forth. We'd like to integrate a little bit of this into the national school science curriculum. We have a lot of Board of Education people that are working with us. And then we would just want to really elevate the importance of non-malarial vector-borne disease at many levels, the policy level, the public health level, and then of course in education. And really, again, the holy grail is really changing cultural norms around safe water storage. So it takes a village to do this work. This is just a picture of most of the people who are in the larger NIH-funded project. For this intervention project in particular, the main players are, again, Jenna, our PhD student, Lydia, who's here with Jenna in the middle. She's a social scientist at the Kenya Medical Research Institute in Malindi, who's been helping us really engage with the community. We also have Mwashe, Joyce, and Kamoni in the bottom left here. There are social scientists that are going out and doing all the interviews. We also have Robin Bundi, who's doing a lot of the vector work, and Francis, guy right here on the right, who is our leader on the coast of Kenya. We also have some other partners here at Stanford, Nicole Ardouin, who is a Department of Education expert, and Noah, who's helping us with the logistics, and then Eleanor, who is doing the artwork and helping us, which is great. And I want to thank Bechtel Faculty Scholar for funding this work. Now, I'm almost done, but it's from pathway to impact, right? So I've tried to tell a little story about how I started, uncovering all this burden of arboviral infection, and then now we're trying to really impact the risk on the ground. But when I really think about the impact of this work, I mean, even if the research goes well, I think there'll be an impact. But when I think truly about what actually is really going to impact the societies that I'm working in, the communities I'm working in, I think about the students. And so I want to thank our study participants too. But the students are the real impact for me. So not only is it impactful for me because working with Jenna and all the other students on this project has really changed the way that I think about questions and the way that I go about doing my own research. But when I think of sustainability and what's going to make the greatest impact in that community, it's the students. And we're training a lot of Kenyan students and a lot of US students on these projects. And that is probably what makes me happiest. Thank you.